Your right hand, because we use your right hand for those, didn't we? Right. So you got to use what? Yeah. So for this part of the series on examination of the injured hand, we are going to be discussing the examination of the flexor tendons of the hand. So when we are examining the flexor tendons of the hand, let's start with the thumb. You just get the patient to actively bend the thumb in, and you can see that the flexor pollicis longus is intact, and you can get them to do that against a bit of resistance, and you may ask them whether they've got pain. Looking at the flexors of the fingers, there are two flexors per finger, and the flexor digitorum superficialis, which allows you to bend at the PIPJ, which is the proximal interphalangeal joint, and the flexor digitorum profundus, which allows you to bend at the DIPJ, which is the distal interphalangeal joint. Now, when you're testing the flexor digitorum superficialis, which is essentially asking someone to actively flex at that joint, you've got to ensure that you neutralize the FDP, because they can then bend this and bend that, so you'll have a secondary flexion of that. So to neutralize the FDP, the profundus tendons, what you take the other 3 digits or couple digits, and you keep it extended. That way, try to bend that. Okay, so they are now limited to just bending with the FDS, because the FDP can't work. And the reason why that is because the FDP muscle comes from here in the forearm as one muscle, belly, and if you neutralize the other 3 tendons, the FDP tendon for this finger can't work, and so you're just allowing only FDS to be actively working for this finger. Similarly, for this finger, if we just hold the other 3, see, and this patient cannot bend, just straighten your fingers, madam. Try if you bend at the tip, and they can't bend it. Okay, so it's essentially FDS. And similarly, you can do that for the ring finger. Now, remember for the little finger that 12% of people may not have an FDS tendon for the little finger, either in one finger or both fingers, that is bilaterally or unilaterally. When you're testing for the FDP, it's a little bit easier, and all you do is you stabilize the middle phalanx, and you ask them to bend the tip of the finger, and you can see that this patient, that the FDP tendon is intact. So you've tested for the FDS, you've tested for the FDP, you've tested for the FPL, and those are the flexor tendons.